and is that bisphenol A at low doses was producing insulin resistance and hyperinsulinemia in mice,
Hmm.
and it was affecting insulin release and other peripheral tissues as well
Hmm.
in adult mice. That was the first
Yeah. So
study
basically,
we did.
basically, when
Yeah,
we think about things like insulin resistance and type 2 diabetes, which we'll probably talk about in different ways, I mean,
yeah,
normally, I think a lot of people, when they think about why someone becomes diabetic, they think about, if it's type 2 diabetes, at least, that this is induced by the diet, that it has to do with sugar and carbohydrate intake. And indeed, those things are very important. But I think what you're starting to say is that you can get insulin resistance by other means. You could be exposed to certain hormones, for example, or certain endocrine disruptors, and even in the absence of, say, drinking Coca-Cola every day, you can still develop
mhm.
insulin resistance in those ways.
Yeah, exactly. I mean, what I think we know now is that many of these endocrine disruptors that we study are part of the diet as well.
Mm.
For instance, bisphenol A, phthalates, and other bisphenols are part of our plastics
Hmm.
components, and I mean they are in food contact material. So when we buy something that is involved in plastic, uh, so this plastic is going to release these bisphenols, phthalates, and other uh, chemicals.
Hmm.
Plastic contain hundreds or thousands of chemicals.
Hmm.
Indeed, it's not only a polymer.
Yeah.
Uh, and, 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 and I think this is part of our diet as well. So we always think in, okay, lipids, sugars, and of course, as you said, this is very important, and it's no doubt that they affect, insulin sensitivity, insulin release, and glucose homeostasis, and are obesogenic in general, the excess. But there are other chemicals